And so as far as the difference in the medical benefits versus IV versus oral therapy, especially the economic impact on institutions as well as patients, what have you seen in your practice with that?
Yeah, I think you know, as we've talked about, more patients are receiving medications at home. So overall, certainly due to COVID-19, but in general, there's less visits to the clinic and certainly to the infusion center to get chemotherapy. You know, depending on if patients are going to get combination therapy or not. I've already mentioned before, but just to reiterate, I think overall there's less hospitalizations for toxicities such as infections and neutropenic fever, and even some of the cardiac toxicities. I think we're getting better at managing those and preventing those, and you know, switching to therapy sooner. I think for some of the economic challenges we've seen have been the timely approval of both the oral and the IV therapy together because of pharmacy benefits and medical benefits, and so that can be a real challenge, especially if patient's disease is very aggressive, and if they've progressed on ibrutinib, it can be really important to start their subsequent therapy very quickly, or it can progress to Richter's transformation. And so I think some of the economic challenges in improving can really be sometimes be a barrier. So I think as pharmacists, anything we can do to facilitate the approval process, and in the clinic, I can certainly help with the prior approval process, prior authorization process in the clinic. And as pharmacists in a situation, you know, helping with some of that facilitation in a delivery and, you know, workflow perspective can be helpful too. Certainly the economic impact on patients from an oral perspective can be greater. Certainly those therapies can be far more expensive. I've definitely found that that can be a challenge, and certainly, as we mentioned before, potentially a reason to use intravenous therapy. However, I think over time there's really a number of really great patient assistance programs that I've certainly been involved with our financial assistance team in enrolling patients either in a copay assistance program or a drug company program. So I think fortunately we found that many patients qualify for those programs, but certainly can be a challenge. What about you? What has been your experience?
Yeah, and I agree with all that. I mean, I think like you mentioned, the oral therapies are definitely, you know, almost staggering in their costs, you know, and that's based on a lot of factors, and you know, every manufacturer sets the costs based on, you know, a lot of research that goes into the medications, but then of course it falls back on the patient. And like you mentioned, a lot of patients in general are going to rely on that assistance program, and you know, with these therapies we're mentioning all being on label, that's usually very doable to get assistance for the patients. But again, you know, nothing's guaranteed, so the assistance may dry up, or you know, we have to work with all of our programs on that. I think just economics often can go hand in hand with adherence too. I mean, just with the access to a ride to the clinic, or, you know, however a patient may get there, if they have a history of non-adherence to oral therapies, you know, the office may want to take that into account when they make decisions on treatments like acalabrutinib BID. If they already were having poor adherence on the once daily dosing, then is a BID dosing the best option to switch to if they progress or something like that. So a lot of factors to consider for sure as we you know, work through all the potential options of therapy for these patients.